Another joint which we are commonly dealing with arthroscopy now is ankle arthroscopy. Ankle pain, again, as I told before, is very, very common in our country. Most of the times, unfortunately, without a proper diagnosis, patients are prescribed analgesics and physiotherapy and say that the pain will go off. You just continue this. Yes, many times it does happen. Patient is going to get better, and patient classically will give you multiple episodes of pain. In a year, they might have 3 or 4 episodes. Every time they come to the doctor, every time they take physio, every time they take analgesic, and they are going to get better after 2 or 3 weeks, and he'll be pain free for 3 months. Again, he's going to come back to you. It just means that they are dealing with something else. What are the common procedures we do there is, you can do debridements. Synovitis is one of the commonest condition which is going to affect the ankle joint. As I said before, you just need to put your finger over the joint and roll over. You get a doughy consistency. When you have that, it is synovial inflammation or synovitis. Debridement is one of the beautiful procedures which is going to give immediate relief to the patient. So another common condition which can be done along with it, synovectomy. You can relieve of the inflamed synovium along with that. And you also have ligamentous tears. One of the commonest ligaments we deal with there is ATFL tears, anterior talofibular ligament tear. It is one of the commonest ligament which is torn in an ankle sprain. Almost 90% of ankle strains are only grade 1 and grade 2, but mind this, there are 10% of grade 3 sprains also, which will not settle down with your conventional physio, which will not settle down with your analysis, and it will not settle down with even with putting a POP. You need to repair that ligament. If, say for example, if it is going to happen in a 50-55-year-old individual, it is not going to affect his life much, because he is not going to do much of walking, he is not going to do much of running or jogging. Say if it happens in a young athlete, say for like a 20-25-year-old, and you miss the condition, he is going to have constant pain every single time he tries to play, every single time he tries to jump, every single time he tries to do something strenuous. So diagnosing these conditions is your cornerstone for giving relief to the patient. The benefits of the surgery far outweigh the disadvantages. There are quite a few celebrities who have done this, and ankle arthroscopy is something which is very fastly becoming popular in our country, especially among sports people. And the next joint which I would like to stress upon would be the hip arthroscopy. It is a relatively new subspecialty which is picking up. Right now it is not very easily accessible. The equipments are very, very expensive, but yes, it is being done. It is starting to catch up. Few of the conditions which we do in terms of the hip joint is going to be a labral tear. There is something called a femoroacetabular impingement. As you all know, the hip joint is a ball and socket joint. There is a socket and the femoral head is the ball which is going to sit inside this joint. When there is an abnormal bony outgrowth or a labral tear which is going to surround these bones, it is going to cause the pain. If you diagnose this, you can again, through an arthroscopy, through a small puncture wound, you can put your camera and instruments into the joint and repair the torn tissue and take off the excessive bony outgrowth. And you can also have chondral lesions here, where the cartilage is separated from the femoral head or from the acetabulum and is acting like a loose body. This will cause multiple episodes of synovitis, and this will cause pain to the patients, which again can be addressed with arthroscopy. Diagnosing these conditions is going to be a little tricky. It is not a very easy condition to diagnose. MRI is going to help you. A good MRI is going to help you along with a good radiologist. So the last joint we are going to talk about now is going to be elbow arthroscopy. Elbow arthroscopy, again, the access to this facility is quite limited, but I don't think it is going to be a far-fetched reality where every major city in the country is going to have specialized arthroscopy centers. And what are the conditions we are going to do with the elbow arthroscopy is synovectomy, joint debridement, tennis elbow release, and you have your contracture release. So the synovectomy and debridement, I'm not going to stress about it. It does almost the same indications as I had stated before. But one other condition, the lateral epicondylitis or tennis elbow release, it is catching up now. Many times the common extensor origin, which is on the lateral epicondyle, gets torn, and this might cause chronic pain to the patient, especially in young individuals, especially involved in sports activities which involves lifting a racket. Say for example a baseball, in our country a cricket, tennis or badminton, where it involves a racket sport. What happens is they do this wrist movement where the extensor is constantly put under stress, and when they try to do it forcibly, the muscles and the ligaments can get avulsed from their origin. This can cause pain. One of the famous celebrity who got this procedure done was our own Sachin Tendulkar, where because of the weight of his bat, he tore that ligament and it was sutured. Now, I think he did the procedure way back some 10-15 years back, and he had been competing on the international stage for quite some time after doing the procedure. And one other condition would be contracture release. Elbow is one of the commonest joint which can get injured, and many a times patients don't do proper rehab and they land up with stiffness. Treating the stiffness is not an easy job. You give them wax therapy, you give them mobilization. It's not a very pleasant condition to deal with. In these conditions, you just put a camera inside the joint and release the adhesions which are sitting onto the skin and the ligamentous tissues. This will immediately relieve the contracture and patient can go back to the normal life cycle, like getting their full range of movement, skipping the entire painful physiotherapy process. Yes, you have an option like that. It would be very useful if you can remember that. So, what about the post-operative care and rehab for these patients is, generally the lower limbs like your hip and knee where arthroscopy is in, you can go back to your weight bearing status as allowed by the surgeon, which usually sits around 2 to 3 weeks post-operatively. Full normal functioning will return by 4 to 6 weeks of time. In the upper limb, this is almost half of what I had told before. And physiotherapy and rehabilitation is mandatory post-scopy. If you don't do this, you will never get the full benefit of the surgery. So get the advice from your physiotherapist and the attending orthopedician. They will guide you on that. And weight bearing status is also depend upon what procedure is going to be done and in which joint it is going to be done. So about the complication, like any surgery, this is also going to have a certain bit of risk, but the percentage is very less. So the risk would be like infections, bleeding, clots, vessel injuries or stiffness. But all these complications are there with your open procedure also. But say for example, I would say the risk of complication in this procedure is only 1/10 of what you handle in open procedures. And the advantages is obviously it is going to be a minimally invasive procedure. You have very little recovery time and the chance of complication, as stated before, is very less. And you can now focus on preserving the joint function, which was never talked before, because most of the orthopedic procedures never talked about the inside of a joint. They only focused about how to reconstruct the bone, how to reconstruct the ligament from the outside. It was never about what is happening inside the joint. With arthroscopy, you now have that option. You can think about preserving the joint function. So, to summarize my talk, arthroscopy is an effective tool for diagnosing and treating various joint problems with minimal disruption to the body function, and beautiful technologies are being developed in concomitant with the 3D robotic assistant arthroscopy is coming up now. Like, it's a very exciting field, and the future of arthroscopy is only getting bigger. So we have now started using it in complex fracture treatment also. So the indications of arthroscopy is significantly improving, and yes, we do have an exciting time ahead of us. Thank you.